In the disease autoimmune glomerulonephritis, the body's own immune system attacks the blood vessels of the glomeruli, which are the part of the kidney that filters the blood. This condition is life-threatening, but current treatments are limited and they carry a high risk of serious side effects. Early signs and symptoms can include blood or protein in the urine, high blood pressure, swelling of your ankles or your face. Symptoms of kidney failure then include lack of appetite, nausea and vomiting, tiredness, difficulty sleeping, dry and itchy skin, and nighttime muscle cramps. Plasma concentrations of coenzyme Q10 are depressed in patients with chronic kidney disease. Coenzyme Q10 supplementation can reduce adverse cardiovascular events, improve mitochondrial function, and decrease oxidative stress in patients with non-dialysis chronic kidney disease and dialysis chronic kidney disease. The best form of CoQ10 is ubiquinol, with doses ranging from 100 to 400 milligrams per day. Compared to the general population, people with chronic kidney disease are at a marked increased risk for cardiovascular disease and bone fracture. Standard in-center hemodialysis itself can cause organ stunning. Vitamin K2, which is a long misunderstood fat-soluble vitamin, holds great potential for treating and preventing these conditions. In fact, a lack of vitamin K2 among chronic kidney disease patients is likely a major risk factor, leaving people vulnerable to these diseases. Vitamin K2 does not participate in coagulation under normal circumstances, and instead it activates a number of extra hepatic proteins that, among other things, channel calcium into the skeleton and away from soft tissues. For this reason, vitamin K2 plays newly recognized pivotal roles in building bone density and reducing arterial calcifications and cardiovascular mortality, which are major health concerns for chronic kidney disease populations. Vitamin K2 also activates other proteins that influence cell growth regulation, making it a key player in cancer prevention and early treatment. For the best results, you want to take vitamin K2 in the form of MK7, and doses range from 100 to 300 micrograms per day. Asymmetric dimetallarginine is an endogenous nitric oxide synthase inhibitor. It's related with impaired endothelial function and poor outcomes in chronic kidney disease patients. In addition, oxidative stress and inflammation are also a common problem in chronic kidney disease patients, and both have an important role in the development and the progression of atherosclerosis and the increase in cardiovascular events in the chronic kidney disease patients. Ascorbic acid vitamin C can be a promising agent in the chronic kidney disease patients for improving the outcome by decreasing oxidative stress and asymmetric dimetallarginine levels. You can check out my other video on autoimmune diseases, on antioxidants and inflammation for more ways to help improve your health here. For the vitamin C, the best form would be liposomal vitamin C. You can check out my video on how to make this at home. The next best form of vitamin C would be a non-acidic pH buffered vitamin C. Vitamin D presents a plethora of different functions that go beyond its role in skeletal homeostasis. It's an efficient endocrine regulator of the renin-angiotensin-aldosterone system and of erythropoiesis. It exerts immunomodulatory effects, and it reduces the cardiovascular events and all-cause mortality. In chronic kidney disease patients, vitamin D's function is impaired. The renin hydrolyzation of its inactive form by the action of 1-alpha hydroxylase declines at the same pace of reduced nephron mass in the glomerulonephritis. Vitamin D supplementation was demonstrated to significantly reduce the proteinuria and to slow the kidney disease progression. It also has potent anti-proliferative and immunomodulating functions, contributing to the inhibition of the kidney inflammation. Cross-sectional studies of children with prevalent nephrotic syndrome have shown that 25 vitamin D deficiency rate can affect from 20 to 100% of the patients. You want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to help to correct any deficiency that you have. Kidney disease is connected to insomnia. Kidney patients tend to be night owls and have irregular or late sleep cycles. Connections with insomnia are noted in traditional Chinese medicine. Large population studies have found that those who sleep less than 5 hours a night are more likely to develop proteinuria. Kidney patients may have low levels of the sleep hormone melatonin. Melatonin is a peptide hormone made from albumin. Albumin is the protein leaking out in the urine. Melatonin peaks between 10 p.m. and 12 midnight. It's difficult to test blood levels, but it's often inferred with sleep trouble. We make less melatonin as we age. The kidneys are built to respond to sleep hormone. Melatonin receptors are found in many different organs of the body, including the kidneys, suggesting that sleep is restorative on many levels. The use of melatonin supplements improved proteinuria in animal tests. Effects of melatonin are attributed to the antioxidant properties and the immune modulating properties. Melatonin has been characterized as an immune stimulant, but it also helps to reduce inflammation and help autoimmune conditions. You could check out my other video on herbs to help you sleep for some possible solutions that may also help here. The Cordyceps mushroom has a very long history of use in traditional Chinese medicine for treating kidney disease. It's the source in nature of the prescription medication cyclosporin, which was a breakthrough medication. In an animal model, it's shown to create less fibrosis and sclerosis of the kidneys. There's an improvement in serum creatinine and BUN levels and reduced proteinuria. The Cordyceps mushroom has been also researched to help immunoglobulin A nephropathy, membranous glomerulonephritis, diabetic neuropathy, lupus nephritis, and to improve kidney transplant health. The efficacy of the Rishi mushroom is attributed to both its immune modulation and the effect on endothelial tissues, which are the lining of the membrane. Rishi makes the kidney less permeable, to help proteinuria and to help stop erosion of the outer membrane of the nephron, the podocyte. Further studies of the Rishi mushroom show that unique compounds, ligziols, isolated from the Rishi, which inhibit the phosphorylation in rat renal proximal tubular cells and decrease inflammation in the mesangium of the glomerulus. Varying components of the Rishi mushroom may have different roles in modifying the immune system. The Rishi mushroom inhibited oxidative damage and apoptosis, which is cell death in cultured kidney cells. Chronically low body temperature is common with nephrotic syndrome. In traditional Chinese medicine, it's characterized that nephrotic syndrome is an internal cold and dampness. The dysfunction of the thyroid is often also observed with nephrotic syndrome. This is particularly important to address in growing children, as the thyroid is involved with growth and development. Why does nephrotic syndrome affect the level of thyroid hormones? Active thyroid hormones can be lost in the urine along with albumin. Thyroid hormone is made from albumin, which is the protein leaking out. Low T3 or T4 is common. A blood test that only looks at TSH levels won't include the free T3 and the free T4. The benefits of addressing a low thyroid with nephrotic syndrome are, as kidney disease can affect the thyroid, also the thyroid can affect the kidneys. In a study, thyroid replacement in nephrotic syndrome patients with low thyroid hormones helped to bring about remission from nephrotic syndrome. You could check out my video on hypothyroidism for more information about supplementing with nascent iodine, tyrosine, and selenium to help to correct this condition naturally. Ginkgo biloba is used to reduce capillary permeability. The kidney is one of the most highly vascular areas of the body. The leaking of protein is associated with increased leaking of capillaries in the kidney. Ginkgo biloba reduced proteinuria by reducing capillary permeability, and the effect was comparable to steroids. Ginkgo also appears to alter the immune response associated with nephrotic syndrome. Ginkgo reduces fibrosis of the kidney by inhibiting the mTOR signaling. The prescription medication rampamine is an immune suppressant that also inhibits the mTOR pathway. Ginkgo also helps the high cholesterol, which is associated with nephrotic syndrome. When the kidney spills protein, the liver responds by producing cholesterol. Reducing proteinuria will reduce the high cholesterol. A cholesterol-lowering agent is often used while proteinuria is being managed. Ginkgo can reduce this very high cholesterol naturally. Consumption of omega-3 polyunsaturated fatty acids found in fish oil suppress inflammatory processes, making these fatty acids attractive candidates for both the prevention and the amelioration of several organ-specific and systemic autoimmune conditions. Both preclinical and clinical studies have been conducted to determine whether fish oil containing omega-3 fatty acids DHA and EPA can be used in the prevention and the treatment of immunoglobulin A nephropathy and lupus nephritis. Several recent clinical trials have provided compelling evidence that omega-3 supplementation could be useful in the treatment of immunoglobulin A nephritis and lupus nephritis. One study has shown that omega-3 polyunsaturated fatty acids may have a therapeutic role in reducing the proteinuria in the patients with chronic glomerular disease. For a serious condition like this, high-dose fish oil, being 9 grams per day, of an EPA-DHA molecularly distilled fish oil blend should be consumed. Curcumin from turmeric. Animal models have shown less sclerosis of the kidney. Curcumin reduced inflammatory compounds, immunoglobulin G, and complement activation when it was consumed. Typical doses of curcumin can range from 1 to 5 grams per day. In order to improve its poor bioavailability, it's often consumed with biopterin, which is a black pepper extract, or it's taken with an oil, such as butter, ghee, coconut oil, or fish oil. In an animal study of nephrotic syndrome, garlic did not reduce proteinuria or the number of glomeruli damaged, but the area of the glomerulus damaged was smaller. Garlic also helped with the cholesterol. Rutin is a bioflavonoid. It's a cofactor of vitamin C, found in foods like buckwheat, apple skins, figs, and rooibos tea. It's chemically similar to quercetin, which is a well-known antioxidant and anti-inflammatory agent. Rutin may reduce the creatinine, the BUN levels, and proteinuria, and it can also help reduce sclerosis and tubular injuries to the kidneys. Dietary supplementation with grains containing high beta-glucan fiber have been shown to attenuate the progression of chronic kidney disease and of vascular calcification in animal models. You can purchase a 1,3,1,6 beta-glucan extract and supplement at doses of up to 500 milligrams per day for its immune balancing effect, its probiotic microbiome enhancing effect, and its fiber benefits for the kidney disease. Cellular metabolic changes during chronic kidney disease may induce higher production of oxygen radicals, and these play a significant role in the progression of renal damage and in the onset of important comorbidities. This condition seems to be in part related to dysfunctional mitochondria that cause an increased electron leakage from the respiratory chain during oxidative phosphorylation, with a consequent generation of reactive oxygen species. Reactive oxygen species are highly active molecules that may oxidize proteins, lipids, and nucleic acids, with a consequent damage of cells and tissues. To mitigate this mitochondria-related functional impairment, a variety of agents, including endogenous and food-derived antioxidants, natural plant extracts, mitochondrial targeted molecules, combined with conventional therapies, could all be employed. You could check out my video on mitochondrial supplements for a list of ways to enhance mitochondrial function with supplements like D-ribose, alpha-lipoic acid, coenzyme Q10, and PQQ. The kidneys are highly dependent on an adequate supply of glutathione to maintain normal function. This is due in part to high rates of aerobic metabolism, particularly in the proximal tubules. Additionally, the kidneys are potentially exposed to high concentrations of oxidants and reactive electrophiles. Glutathione can be increased naturally by supplementing with S-acetylglutathione at 200 milligrams per day, or reduced glutathione at 1000 milligrams per day. You can also supplement with its precursors, selenium, example by eating 3 Brazil nuts per day, and taking N-acetylcysteine at 500 milligrams 3 times per day. Eating asparagus is also a natural way to increase glutathione levels. The Mthfr polymorphism. Abnormalities in the gene regulating the methylene tetrahydrofolate reductase enzyme are associated with increased homocysteine levels and increased mortality in normal and in chronic kidney disease patients. For more information, you want to check out my video on the Mthfr polymorphism to find out ways that supplements can help treat this condition naturally.